We have a very special kitten at Wayside right now. Her name is Gaby, and she has a very special condition. And this is Dr. Lou, one of the veterinarians at Wayside. And tell me, what's so special about Gaby?
Yeah, so Gaby has a condition called hypothyroidism.
What's that?
So it means that she has low thyroid. So the thyroid hormone is responsible for controlling metabolism. It's responsible for growth, brain development, bone development, everything that would be responsible for a young growing kitten. And she is not producing enough, so right now we have to supplement her.
What made you suspect she had this condition?
We suspected something was wrong when she was really small and not growing very well. At about 2 months of age, 2.5 months, she weighed only 1 pound, and normal weight at that age should be about 2 to 2.5 pounds. And also compared to her litter mates, she was extremely small. Her temperature was also low, and that's common with this disease. They can't regulate their temperature well. But then also her face was very round, and that's classic with the congenital hypothyroidism.
She almost looked like a little munchkin.
Yeah, she looks kind of like, like a very newborn kind of kitten. Just kind of her features aren't very well developed with this condition. So we did some blood work and we confirmed that she does have hypothyroidism, and she has been supplemented with a pill and is doing very well, and is almost at her normal weight, and is now able to regulate her temperature and is otherwise a pretty normal kitten right now.
That's great. So does that mean then that any potential adopter is going to have to take special precautions with her?
With Gaby, it's really great because we were able to diagnose it so early in life. Her prognosis is very good. Some cats with this condition, this is actually a very rare condition. We see this more in older dogs. With cats, when you talk about thyroid disease, we usually see hyper, which means they have too much thyroid hormone. So this is a very rare thing with Gaby. But she will need to be on a pill lifelong. Right now she gets it once a day, and so the future doctor will have to be very committed to being able to give her the medication, or else she won't do well. And then they'll also need to develop a good relationship with their vet and go to their vet for regular recheck exams to make sure that she is doing well, and then also recheck her blood work to make sure the thyroid level is in the appropriate range. And for a young kitten now, she probably, until she reaches an adult weight, will probably need to go to a vet maybe as frequently as once a month to maybe every 2 months. So it's a lot more than most adopters are looking for. And then once she reaches an adult weight and is doing very well, visits will probably need to be less frequently. Probably, I would guess most vets would recommend twice a year, but I would recommend that the adopters speak with their vet about that. But it will be just very important that they, are committed to, providing her the care that she needs. And if they do that, she will continue to do remarkably well.
So this little girl, this very special little girl, is looking for a very special adopter who will give her the care that she needs. And is there any reason why she can't live a normal life?
I think that she will be pretty normal. Like I said, as we caught it earlier, I've read a lot of stories of adult cats that have had this condition for a long time, and their bones don't develop well, they have neurologic problems. But since with Gaby, where we were treating her so early in life, I think that she'll be pretty much a normal cat. She may end up being a little bit smaller. Right now she currently is slightly smaller than she should be, but otherwise her energy level is normal. Like everything else about her is normal, so I don't see any reason she won't have a great rest of her life and live a very long life too.
I would imagine that since she has learned to take pills as a kitten, that's going to be something that she'll just get used to, and it will become an everyday, just an everyday thing with her. And so I don't imagine that it's going to be too tough to pill her.
Right now she's very good with her medication. She takes her pills in pill pockets, which are soft treats. So she thinks that it's actually a treat that she's taking. If she were to ever not want to take those pill pockets, the adopter would have to talk to their vet about, either getting the medication made into a liquid or, figure out some other way to get it in her. But right now she's very good about taking her pills.
As you can see, little Miss Gaby has come a long way, with the exception of a daily thyroid pill and the fact that she's gonna get to know her vet just a little bit better than the average cat. Gaby is your typical kitten, fun, energetic, playful, and very friendly. If she's the kind of kitten that you think might fit into your family, come visit Gaby. She's available for adoption today at Wayside.